This choice to weaken the definitions allows almost all companies to avoid accountability. And what's more, affected individuals who have been denied a job, an apartment, or healthcare would likely not know about it because of the weak language around use notice. My name is Samantha Gordon. I'm with Tech Equity. Thanks to the staff and to the agency leadership and the board, there has been a lot of hard and diligent work we can see going into these regulations. You will hear, however, in my comments, our frustration with where the regulations have landed. There's a large number of labor, consumer, tech policy experts, advocates who have all been weighing in really diligently on these regulations, showing up here at this board, painstakingly reviewing these comments and regulations. I would also note, I know there's been questions about whether or not folks are interpreting them correctly. And so I just also want to lift up the level of PhDs that have been reviewing these regulations on our behalf, not to mention lawyers and people with lived experience who you hear here in this room. So despite all of this work, we've seen that many of the recommendations we've made, almost all of them, have been ignored as these successive rounds of lobbying have happened in front of this board, and we've seen the regulations get weaker and weaker. We're deeply concerned about two things in particular, but many things overall. The extremely narrow definition of ADMTs. Under this definition, as you all know, a company could decide that their system does not substantially replace human decisions and is not covered by these regulations. For example, a national health insurer reportedly implemented an ADMT that used personal data to analyze insurance claims. And under that system, doctors are supposed to review them before making the final decision. And that decision would deny or approve payment for patient care. So under this definition of ADMTs, we assume companies would not consider this use as covered, right? A doctor is reviewing it, it's not substantially replacing. However, an independent investigation found that these doctors only spent an average of 1.2 seconds to review each health insurance claim. Under the current regs, businesses will point to human involvement to exempt them from providing patients proper notice and explanation, even when the business's use of their personal data creates significant risk to the consumer of an inaccurate or harmful decision. And as the CPPA themselves have acknowledged, this choice to weaken the definitions allows almost all companies to avoid accountability, exempting a reportedly 90% of entities covered by this agency. And what's more, even in the slim number of cases in which these draft regulations would apply, affected individuals who have been denied a job, an apartment, or healthcare would likely not know about it because of the weak language around use notice. We heard today, that there are questions about whether or not the concerns are overblown or maybe that, folks aren't interpreting these regulations. Unfortunately, the concerns are not hypothetical. They're based on evidence of what companies do with these types of loopholes, both in the implementation of regulations surrounding ADS and other jurisdictions, but additionally with the interpretations of guidelines when it comes to protecting workers and consumers' rights. These are not ill-informed or naive concerns. They are based on collectively decades of experience with why companies fight for these changes in the first place. You will hear companies today tell you these are balanced, these are great, and you will hear workers and consumers tell you we do not have enough protections based on the regulations as written.